noted deficits in sensory, you would probably like recommend an OT at that point. If there were deficits in language, you'd refer up. It's not really for treatment development for those specific areas.
Not for those areas because of what we have in-house, but you know, if I think they might need case management services, I can make that recommendation, or you know, those type of stuff. So, but trying to get them to whatever it is that they need, how are we going to get them? If it's outside, if it's in-house, if there's other places. So, yeah.
Does your training prepare you, for adults and children? Obviously, the developmental stuff is different than
Yes.
an adult.
And so for me specifically, majority of my training has been through children, but I've also, in the past year, I've also worked more with adults. And then now getting more into the older adults' memory type of issues, those kind of things. So yeah, it's kind of a long range, but then there are also specializations within neuropsychology. You can actually be a pediatric neuropsychologist or a geriatric neuropsychologist. So there's even further specializations if you really kind of want to narrow in just a certain age range.
This has just been great information. I appreciate this presentation. Just a question, what has been like maybe your biggest surprise as you've been doing these tests, or have you had any like kind of surprises or things you've been struck by with your human population?
Surprises, but I think it's just the thing that has been challenging is just the level of complexity based on background, based on development, based on current environmental kind of family. It's really a lot more difficult to tease out certain things. You know, if someone has a history of schizophrenia, other things, but then there's a question of ADHD, it's a lot harder to tease out because schizophrenic profiles have inattention, they have other issues. But then considering family factors, so it's really a lot more difficult to kind of tease out versus, you know, if someone's from the Brady Bunch and they have difficulty concentrating, that's probably a little easier to kind of tease out and figure out. So I think the complexity has been.
Yeah, a few minutes ago you were talking about different specialties. My wife and I had a highly unfortunate situation a few years ago. Our son Nate was 10th grade, soccer player, went up for a header, got another kid's head instead of the ball, significant head injury, brain trauma there. And we eventually took him to the Pine Rest Psychological Consultation Center for a neuropsych test because there's a huge plummet in his grades. He had been one of these perfect students, quick learner, all of that was gone. And then we finally sat down for the feedback session with the psychologist, and he basically said, testing showed absolutely nothing. And in asking him more questions, he admitted that his specialty in neuropsych is dementia. And and I think that's one important question we need to ask.
Yes.
You know, the neuropsychologist needs to be a match in the specialty with
Exactly. And
with what the presenting problem is.
And that's where the ethical, you know, that person, I don't know who they are, but ethically that's concerning.
Yeah.
Because even with that initial question, hopefully they asked you about head trauma during the interview, and given that and given the age, they should have known to either consult on the case or something else, but that was pretty straightforward, that anyone would kind of connect those dots. So, I hear that.
But kind of to piggyback that, isn't it kind of true in some of those that the brain can regenerate, or to what degree, like after an injury like that?
Yes, and yes, it's not, yes, the brain is pretty neuroplastic, and so new pathways can be created, but doesn't mean that it's always going to be great pathways. And we can't control how the brain is going to go around that. So they might create a new road, but what if they're going down a bumpy road? So.
Well, and actually what happened after that was, upon the recommendation of a friend who's a physical therapist, we took Nate to the Spectrum Health, I think it's called the Minimal Brain Injury program in Grand Rapids, and the neuropsychologist there, within 30 minutes, diagnosed the problem. And then treatment was started,
and especially that young, there's different cognitive rehabilitations you can do, different methods for that. So
yeah, I mean, treatment was very effective. But that psychologist.
And unfortunately,
new
it still happens.
sports-related head injuries.
Right, and unfortunately, that still happens fairly often, and I think especially out here, Grand Rapids has a lot more resources, I've noticed, in terms of those things, and I've encountered that as challenging in terms of making recommendations, referrals, to where locally can we send them transportation issues, not everyone can get out there, so.
I have a question slash comment too. My son got a neurological exam, so it's not the assessment that you do, but they said there was a cyst on his brain, but they said that that's normal. Now, have you ever heard, I mean, does that ever affect anyone? Like, do you, because they say that it's actually common, that most of us probably have one. But I wonder, like, have you ever had somebody come back that's had that, and does it really affect their behaviors, or, you know?
It can, I mean, again, you know, do we all have probably a little benign cyst? Probably. But can it impact? Definitely, but again, it's gonna depend where on the brain it
Yeah,
is, how
that's
thick
true.
it is, age of the person, just different types of developmental stuff. With them, so.
It took them 18 years to finally scan his brain, but
Yeah.
that's what they found. I just wondered if maybe that was the cause of some of the problem.
And I think then the question is, well, where is it? You know, and then you look at kind of those areas. Is it by certain important areas that perhaps have to do with certain
So
behaviors?
technically, they probably should refer that somewhere else, depending, right, like, I wonder if I should pursue that a little
Or
further.
even, I mean, anything neurological seizures. Okay, seizures can have correlation with certain behaviors, rages and things like that. So there's a lot of host of different things that can happen.
Well, I mean, a huge takeaway today, for me anyway, is just how important it is to understand what your needs are and what the expertise of the psychologist that's doing the eval. And you think about it, it'd be so easy not to identify the proper, I mean, let's say you didn't know your child had a head contact that had happened, and you didn't know, or something else that was going on, so then you get this report, you know what I mean? So
Or parents don't even think about, you know, well, he didn't fall off the bed when he was about 2 years old.
yeah, right. So getting that right person, the
Yeah.
right person for
You have to ask
the
the right
right,
questions.
right, and that's hard in and of
Yeah.
itself
Yeah.
sometimes, but.
Yeah, because then they might be like, well, did you get the doctor? Well, no. Did you notice any changes? Well, yeah, he kind of talked funny afterwards for a week. That happened.
Right.
And then you're kind of connecting, well, where did they hit the head? Okay, really look into this.
So again, I'm sorry to keep perseverating on this, but I'm just thinking when we have families that we want to get a a psychological eval, I'm still not sure I feel confident to know the questions that I would ask to make sure that the psychologist is the right fit for that child's issues. So, you know what I'm saying? That, like, I'm imagining you need to, I used to just think, oh, it's a psychologist, you know, kind of stamp, but, so.
Well, and that's where, ideally, that's where the ethics of the professional should come in, when, you know, you shouldn't have the responsibility of having to ask every right question. That's supposed to be our job, try to be that detective and to really see, am I the best case for this? And ethically, should I see this person or should I refer them out?
Sometimes we're advocating for people
Yeah.
with community providers, and there might be somebody that usually does the psychologicals, but that might not be exactly what
Right.
this person needs, so we might encourage them to.
Right, and I think that's where having consultation, just establishing connections with other professionals, you can be like, hey, let me run this by you. You know, I've been seeing this. I don't know if this person's right for testing, but some stuff happened. Let's talk about it, and then we can kind of meet. Or another
Well, even talking to the parents about it too, and saying, hey, you know, you need to advocate for your child, make sure this is a good fit, and maybe just by explaining it like that to the parent, they know going into it, maybe this person isn't the right fit, maybe I need to ask some more questions.
And then sometimes what happens too is because parents are based on the diagnosis, they might not be happy with me.
Right.
What do you mean he's not spectrum? He's totally spectrum. And it's like, no, they're sensory spectrum. And then it's having to educate them and explain how, yes, it definitely looks like, okay, but this is why it's not, okay, and this is why it's this. Parents can be upset. Adults can be upset. I have a feedback coming out for. I'm not looking forward to it. I know you're not going to get my ADHD diagnosis. Okay, it's memory stuff. And then having to, on top of that, then you might have Alzheimer's or something else going
Especially when SSI or other monetary things are involved with those diagnoses.
And that's where my disclaimer at the beginning, there's no guarantees. Remind them, you remember? It was 5 times I told you over and over, there's no guarantees. Kind of my catch-all. And so like I mentioned, I'll put this on the drive. As we talk about other topics that we're gonna cover, like attention in those other areas, I'll also make those PowerPoints available. And then I think I mentioned I'll also put different readings, articles, just helpful information. And when I do the presentations, we're gonna gear it a little bit differently, I think, to be most helpful in that I'll just touch upon some of the theory stuff, but it's not gonna be like a course. It's gonna be more what can you as clinicians look for, how can you modify your treatments, that kind of type of information. It's gonna be more based that way. And then if you want information, if you want more of the theory stuff, I'll make those articles available to you on the drive.
Thank you.
Questions from my office?
Good job.